I'm Beth Meyerson, for many of you who already know that. Welcome to the inaugural grand rounds of our lab. And so happy that Jon is going to kick us off with the science of trust. I'll introduce him in just a minute. For those who are new to the lab, just to tell you, our lab is Harm Reduction Research Labs located at the College of Nursing at the University of Arizona. We have faculty from 9 universities across many disciplines and a community-based organization. We center our work around a group called the DPRAB, Drug Policy Research and Advocacy Board. This is a group, I would say they're my board of directors. They are people with lived experience in a lot of things: drug use, mental health, trauma, a variety of areas that matter, treatment, for example. They are providers, they are government payers, harm reduction, regulators, et cetera. And we're a training pipeline for citizen scientists, academic and clinical researchers, but we focus at the structural level. So our focus is on policy and on practice, nursing, pharmacy, and medicine. If you're interested in the lab, you can always reach out. We have certainly a lot of opportunities for students. The next grand rounds will be in February. Dr. Lindy Krieger will be our speaker. And you can register for that now. We'll send out a flyer shortly. Dr. Jon Agley is an associate professor of applied health sciences at the Indiana University School of Public Health in Bloomington. He's also the interim executive director of Prevention Insights. That's a translational research center within the IU School of Public Health in Bloomington. Jon studies substance use and mental health, as well as methodology and meta science, the science of science. And he has been named a fellow of the American Academy of Health Behavior, that was 2022, and Academy of Behavioral Medicine, 2023. He received the Clifford B. Reifler Award for Outstanding Contributions to the Journal of American College Health in 2023. I think there was only like 2 people that got that award, and received multiple awards for research excellence at Indiana University, as well as the Trustees Teaching Awards. His work has been funded by the NIH and HRSA and SAMHSA and CDC, as well as many other state and local entities and nonprofit foundations. So with that in mind, Jon, I'm going to pass it over to you. I will manage chat, and thank you so much.
All right, thanks, Beth. And for the record, I was asked to make a fancier profile. My original version was a little a little briefer than that, but Beth is always an advocate for people. So, all right. So can everyone see my screen right now? Okay, perfect.
Yeah.
So, this is a talk on the science of trust, and specifically about language choice, which seems kind of like a boring topic. I I don't think it is, actually. I'm going to make the case that it's not. This is based on a paper that I worked on with a team of people in 2023. I'll give some more information about the paper throughout the talk. But what I want to lead into first is this idea about why trust matters when we're communicating science and when we're doing science. And it all comes back to, in my opinion, to this quote: "We know by trusting what others tell us." And I want you to sit with that for a moment, because we don't have, as individuals, the ability to independently obtain information about everything we encounter. We're not even close. We don't have the money, we don't have the time, we don't have the positionality. In order to make decisions about what we know about the world, we have to engage in a reciprocal trust relationship with people, with information sources. And so much of our knowledge and much of the way that we process knowledge is based on this idea that when someone says something, we make a trust decision. And that's why, in science communication and in science writing, this concept of trust matters a lot. It's not something that we talk about very often. But here's some basic examples. Recipes. When we're cooking, we don't just throw random stuff. I mean, maybe when you're a kid you do, but in general, you don't just throw random stuff in the oven and hope that magic happens. We trust people. We trust maybe Gordon Ramsay a little more than your nephew, and maybe your nephew a little more than someone else. So there's grades of trust, but weather reports. We have to make decisions about to what degree do we trust this weather report? To what degree do we understand it? Electricians, great people to trust, especially if you don't want to electrocute yourself, or you don't want your house to burn down. Lifeguards. We every day we engage in these trust-based relationships, and we take what they state to us as knowledge. And the degree to which we're confident in that knowledge is proportional to the degree to which we trust that individual. Now, this is actually a it illustrates a problem with that very common phrase that I'll put in air quotes, trust the science. Because not all scientists are the same, not all scientific documents are the same. Science is a process, it's not a it's not a person. And so the trust relationship is really far more complex than one of those short phrase, a short phrase like that can explain. I promise I'll take us back out of this rabbit hole, but I want to go a little deeper in it. All right. So when people make factual statements to us that we're deciding whether or not to trust, those factual statements are what are called cognitive claims, or they're statements about empirical knowledge. So if a lifeguard says, hey, the current's really strong out by the pier, that's a cognitive claim. In other words, it's a claim that is specifically pertinent to that pier, that point of time, and it's a statement of fact that the current is strong. The outlet is wired incorrectly, same thing. And so these are things. Now, someone might be an expert swimmer and maybe they have the ability, but in general, for the average person, we don't have the ability to generate our own empirical knowledge about these things. And so we have to trust, we have to well, we don't have to trust, but we have to decide, do we trust the person who is giving us this information? But I also want you to note what was not written. So I wrote the current is really strong out by the pier, and I did not write, so you should not swim there. And I wrote the outlet is wired incorrectly. I did not write, so you should not plug your space heater into it overnight. There's a reason I didn't write those things. For now, we're not talking about these kinds of statements, which are called normative statements. We're focused on
We're focused.
cognitive statements. These are statements about reality, that the current is really strong. They're not statements about what the implications of that current are. So this is a philosophical separation. It doesn't seem like it matters much. Um, what I found and what I'll describe in my research on how people ingest science findings is that this distinction might matter a lot more than you might think. Much of the debate we see around science communication revolves around the fact that whether something is true is completely different, and I mean completely different from what we ought to do if it is true. So take a moment and think about that in terms of your own research findings. Think about things that you have discovered, and then, and I'm guilty of this, we all are, think about your discussion sections in your papers where you've said, I found X. Policymakers should dot dot dot. So there is a fundamental difference in what we're communicating through our work. Now, what's important is that the trust relationship is also fundamentally different for cognitive claims and normative claims. For a cognitive claim, you're trusting that the person who is sharing the information with you has a good reason to believe that that's true. So like when a lifeguard says the current's really strong out by the pier, you're trusting that the lifeguard has, the ability to measure the current or has some experience and that they have some credentialing or that they have some characteristics that help you decide, I think they have a good reason to say that, and so I'm going to trust that information. Same thing with the outlets, the same kind of example. that formula doesn't necessarily apply with normative communication. When someone says you should do something, you should not swim by the pier on the basis of the fact that the current is really strong, you're getting into an entirely different trust relationship. What you're encountering there is the idea that that person's assessment of what you should do is aligned with your own interests. So here's an example. The current is really strong out by the pier. So you should not swim there. For many people, this is true. But if you're at the pier to measure the current, if you're at the pier because you enjoy swimming against strong currents and you're preparing for a triathlon, if you're testing out a new diving suit, there are all these kind of situations in which the current, it can be true that the current is really strong, but it may not be accurate in your case that the phrase you shouldn't swim there aligns with your own interests. This is why normative, or this is the fundamental way that normative and cognitive claims differ in how they're received by people. Because to to trust a cognitive claim, to trust an empirical claim, you just have to trust that the person has a good reason to make that statement. And then there are other factors you can consider too, like does this person have a history of being accurate? Does this person have a reason to tell the truth? There's a lot of, I don't mean to downplay the complexity of it, but it's fundamentally different than the added layer with these normative claims that have like the S word should, where when someone says someone should do something, there's a presumption that of your interests. You see what I mean? So when someone says you should do something, there's a presumption that the interests, the person's understanding of your interests is actually in alignment with your real interests. I'll use a real life example because this gets a little esoteric here. We hypothesized in a study that if you report scientific findings using normative language, it would reduce people's perceptions of trust and credibility of the science that you're reporting, and would also reduce perceptions of trust and credibility of you as an author and your work. And to test this, we did a large, nationally representative, randomized controlled trial. And we did a very, very simple manipulation in this trial. I don't know how well you can see this, so I'll read these examples out. So I made a fake Facebook post in the style of Facebook, dark mode. And I took quotes from a real paper that was published in April 2020, right after COVID started really affecting the US. And I randomized people to see one of two posts. And the first post, and again, I'll read this out loud so you don't have to squint. The first post read, scientists use models based on data from New York and Washington. Their results showed that broad adoption of even relatively ineffective face masks may meaningfully reduce community transmission of COVID-19 and decrease peak hospitalizations and death. Now, that's a cognitive claim. It's a statement about it's the authors are making a statement about reality. They're just saying, based on data we have, if people do X, Y is a likely result. Now, I'm not saying that that's actually accurate or not, but I'm presenting people in this study just with this insular instance of a cognitive claim as presented as a Facebook post, basically, in which we're saying here, 700 and some people just saw that. The other half of the people saw that first paragraph. You can see on the right, it just is a little longer. They saw that first paragraph, and then they saw the the next sentence in the paper, which was based on their findings. The study authors suggested that face mask use should be as nearly universal, i.e., nationwide as possible, and implemented without delay, even if most masks are homemade and of relatively low quality. So you see the study, the intervention and manipulation here. This is a normative claim. And these are real things that were said in the paper. On the left-hand side, you know, it, this was the real cognitive claim. On the right-hand side, people were shown the cognitive claim and they were shown a normative claim, a should. So it wasn't just, given X, we expect Y to happen. It went on to say, so people should do something. And so you see there's an additional layer here, which is the expectation that people's interests reading the post align with the interest underlying that normative statement. Now, we thought that even though this is just a 30-second intervention, we thought that people would broadly distrust the example with the normative statement included and trust the example with the cognitive statement included. That was our broad expectation. But what actually happened was there was functionally no difference, and this was including pretty extensive controls. We had all kinds of sociodemographic variables, um, political alignment, religious membership, all kinds of things. There were 5 different measures of trust and credibility, and these weren't just single questions. A lot of times with like the Pew survey, you see like one question. You know, on a scale of 1 to 10, how much do you trust the following entities? There was a broad question about trust, which was a 21-item scale that really kind of dug into epistemology, beliefs about scientists. And there were also questions that focused on perceiving that the poster, the scientist who made the post is trustworthy and credible, and the science is credible. Um, and then also that the scientist is credible and the post is trustworthy. So it's all these different measures. There's one example here, but all the results look like this. When you look at the broad sample, the normative and cognitive language didn't matter at first. But we had a second set of hypotheses that we had pre-registered in this study, and here's where things got interesting. Um, in this graph, you see the intervention arm is the blue line and the control arm is the yellow line. And what we found is that there was a significant interaction effect about who trusted the author of the post. And this interaction effect is also the reason why, when you aggregated all the data, it looked like there wasn't an effect from the experimental manipulation. People who were to the left of center politically actually trusted the author more when they used normative language. So when the post said what people should do, that actually engendered more trust among people on the political left. When the post only had cognitive language and did not make any normative statements, then the trust was higher, or that those people to the right were more likely to trust that post. So what this means in terms of our finding is there was actually a differential response such that what kind of um, the I'm trying to think how to put this in a parsimonious way. Whether you trust the author of a scientific post, like the examples I showed, um, actually depends not only on the kind of language used, but on the political orientation. And people of different political orientations actually respond differently to the presence of cognitive or normative language. This, to me, has some pretty substantive implications for how we discuss our research findings and how we um, better understand our audiences, because it suggests that there is, let me take a step back. Let me give you the caveats first before I get to that, because the caveats are important. Um, so I want to first, these are, basic limitations. This is a single exposure of a dose of at least 30 seconds. And it specifically pertained to a topic that's highly politicized. and that matters because generalizability of this is limited. So I'm the reason I paused and went to this slide first is because I want to use some language that is slightly general, but I want to be clear that this statement on the right-hand side of the screen is really the quote unquote official finding. It's plausible, though not by any means certain, that the effects of normative language on trust and credibility manifest differently in opposite directions on the ends of the political spectrum. So, what does that mean in practice? It means that some people actually prefer just the basically the results section, and they actually will trust science information more given only the results, and that normative claims made in the discussion section may actually reduce the perception of how trustworthy that scientist is. But it's not the case that that's always true. And in fact, if for some audiences, if you only present the results and you don't make normative claims, it may actually reduce the degree to which they trust you. This is to me incredibly complicated. But think back across all the discussion and the debate we've had about public health, trust in science. A lot of this acrimony has really focused on normative claims. If you think back, um, and that has some implications for our science communication because people trusting normative claims means that people believe that your perception of their interests is in alignment with their true interests. So when someone says, so masking should be as universal as possible, which is how those authors wrote about face masks in that study, those authors presume some interests about people. And even if someone agreed with their cognitive results, even if someone said, you know what, these data are compelling, it makes sense that mask wearing may reduce incidence of COVID. It doesn't necessarily follow that they would agree that everyone should wear a mask. Now, if there are some people who might say, yes, everyone should wear a mask because I greatly value X and Y. But if, for example, if your value system says, I would prefer not to be told what to do, even at the cost of something else, then all of a sudden, the inclusion of that normative statement might engender distrust even in your cognitive claim. You see what I mean? So this is, as I warned Beth, it's only about a 25-30 minute presentation because I want to have discussion about this. This paper is extremely long, and if you're interested in it, you can scan this. All the data, all the code for the paper are there. The raw data are accessible. You can analyze the data if you're interested. Um, all the analytic codes available. So this is the paper this is based on. But the basic premise of this idea, to summarize, is when we communicate about science, we make claims about reality, and then we often make claims about what people should do. And this is typically in the discussion section. And how people or the decisions people make about whether to trust our communication or not, whether we're trustworthy as communicators, actually may differ depending on how we use language. And so it's important to be very cognizant of what we're saying when and it's not that people shouldn't necessarily report normative language, but there are caveats that we can use. There are caveats that can say, you know, even just from the perspective of these authors, one possible, next step might be versus just saying people should do. I would love for more testing of this concept. This is, I thought this paper, I'll be honest, I thought this paper was going to get a lot more uptake than it did. This this is generally in line with my experience with research funding and citations, which is the more interesting something is, the less interested people seem to be in it. Um, to to me, this is actually, I think, a really interesting finding that I've not found any interest in anyone funding. Um, but that's why I made all the one of many reasons I made all the data open. People can feel free to run with this if you think it's interesting. I think there's something here in terms of science communication beyond what I talked about today. Um, this is just a basic overview of this, first cognitive and normative claims. And second, the idea of the trust relationship. Why does it matter? Why do we care if people trust us? Um, and it's important to understand that people's knowledge is predicated on trust. It's predicated on who they decide to trust. And so the trust relationship really does matter. It's not kind of abstract or ephemeral. It actually has a meaningful implication for what we do. It's important, um, if you want your knowledge to be added into people's calculus about what to do, it's important that you build a trust relationship. Because without that trust, it's unlikely that your knowledge will actually be subsumed into the decision-making process.